Welcome to the Terry Podcast, the place to go to really get to the heart of what matters when it comes to making sure that patient care is top-notch and, of course, safe.
Absolutely. And, it's always fascinating to me how much goes on behind the scenes to achieve that.
Right.
So today we're going to be going deep into a topic that the Terry Medical Quality team put together. It's all about how hospitals make sure that they're delivering the highest quality of care to every single patient.
So we're going to be taking a look at a really interesting document, basically a CBAHI medical staff review interview.
Yeah, CBAH, that's the Saudi Central Board for Accreditation of Healthcare Institutions. They're the ones that really set the bar high for hospitals in the region.
Exactly. And this review covers so much ground. It's incredible. I mean, we're talking about everything from the responsibilities that each member of the medical staff has to the standards of care that guide every interaction with a patient. And then there's the whole aspect of safety within the hospital.
That's right. It's all connected. And I think what we're going to see as we dig into this is that it's not just about having rules and regulations. It's about creating a culture of quality and safety.
Yeah, and I think that's something that's really important for our listeners to understand. We often focus on the clinical aspects of healthcare, but the systems and processes in place are just as crucial for good patient outcomes.
Absolutely. So should we jump right in then?
Let's do it.
Yeah.
One of the first things that really jumped out at me was the emphasis on the medical staff bylaws.
Ah, yes. The bylaws, they're like the foundation of the whole structure.
Right. I mean, they outline everything, don't they? From the
Yeah.
organization chart to specific job descriptions.
Exactly. Think of it like a constitution for the medical team within the hospital. Who reports to whom, everyone knows what their role is and what's expected of them.
And there's also a system of ranking and categories,
Yeah.
right? So it's clear who has what level of responsibility.
Precisely. It ensures clarity and accountability within the team. I mean, you've got to know who's calling the shots in certain situations.
Right. And it's not just about who's who. It's also about how new physicians are brought on board and what they're allowed to do.
Absolutely. Credentialing and privileging. Those are the two big processes here.
So credentialing is all about making sure that a physician is who they say they are, right, and that they have the right qualifications.
Exactly. It's like a thorough background check, verifying their training, their experience, everything. They have to prove they're up to the task.
And then privileging, that's about defining what procedures and treatments they're actually authorized to perform in the hospital.
Right. Based on their credentials, they're granted specific privileges. It ensures that everyone is practicing within their area of expertise.
And there's also a process for appeals,
Right.
right? Just in case a physician disagrees with a decision about their credentials or privileges.
Yeah, that's essential. It's all about fairness and due process, making sure everyone has a voice.
Moving on from the kind of internal structure of the medical staff, the review also delves into the standards of patient care and professional conduct.
Ah, yes. These standards, they're the guiding principles for every single interaction that a patient has within the hospital.
So we're talking about everything from the moment a patient is admitted to the hospital right through to their discharge.
Exactly. Admission, transfer, consultation, discharge. It's all covered. And then there's the really important aspect of documentation in the medical records.
I can imagine that's crucial for so many reasons.
Oh, absolutely. It ensures that there's clear communication between all the different healthcare professionals involved in a patient's care.
Right, so everyone is on the same page.
Exactly. It's about continuity of care, making sure that nothing falls through the cracks when there are multiple people involved in a patient's treatment.
Makes sense. And of course, good documentation is also essential from a legal standpoint.
Absolutely. It provides a comprehensive record of everything that was done for the patient.
Now, shifting gears a bit, every hospital has to define what services they can actually provide, right? It's not like every hospital can treat every single condition.
That's a very important point. It's called the scope of services, and it's basically what the hospital is equipped to handle.
So this information needs to be really clear and accessible to the public, right?
Absolutely. The hospital has to be transparent about what it can and cannot do. And that information should be easily found in places like the patient handbook or on the hospital's website.
Right, so patients know what to expect and can make informed decisions about where to seek care,
Exactly. And this ties directly into the concept of patient screening.
which I guess is all about making sure that a patient's needs align with the hospital's capabilities.
Precisely. It happens at several key points, like before a patient is even admitted, during OPD registration, and of course in the ER triage.
Right, so it's about quickly assessing the situation and making sure that the hospital has the resources to properly care for the patient.
Exactly. It's a crucial safety net. It wouldn't be right to admit a patient if the hospital couldn't provide the level of care they needed.
And I can imagine that things get especially tricky when a hospital reaches capacity.
Oh, yeah. That's a tough situation. When there just aren't any inpatient beds available.
So what happens then? Are patients just turned away?
No, no, not at all. They still receive care, but it might mean being cared for in a designated ER boarding area until a bed becomes available.
I see. And is the standard of care in these boarding areas the same as in a regular inpatient bed?
Absolutely. It has to be. The quality of care shouldn't be compromised just because the hospital is full.
And what about patients who are critically ill and need intensive care?
In those cases, it's all about getting intensivists involved as soon as possible.
Intensivists?
Yeah, those are physicians who specialize in critical care medicine. They're the experts in managing really complex cases.
Okay, so once a bed does become available,
hmm
what's the actual process for admitting a patient?
It's a multi-step process that's been designed to be as smooth as possible.
So walk me through it.
Sure. First, there's a full assessment of the patient's medical condition. Then they're reviewed against the admission criteria to make sure they actually meet the requirements for inpatient care.
Okay.
Then comes all the paperwork, the admission forms and all that. Once that's done, the patient is transferred to the right ward or unit.
Got it.
And then finally, and this is super important, there's a structured handover using the SBAR framework.
SBAR. What's that?
It stands for Situation, Background Assessment, and Recommendation. It's basically a standardized way for healthcare professionals to communicate about a patient's condition.
So it ensures that everyone is on the same page and that nothing gets missed.
Exactly. It's all about clear and concise communication.
Now, one thing that really struck me in these materials is the emphasis on uniform standards of care.
Right. That's about making sure that everyone receives the same high quality of care no matter what.
Regardless of their background, their financial situation,
Right.
any of that.
Exactly. These standards apply across all departments and all times of day. It's about equity and fairness in healthcare.
It makes sense, but I imagine it's not always easy to achieve in practice.
It does take a concerted effort, but it's absolutely essential. It's about removing any potential biases or disparities in the care that's provided.
And it's not just about the medical treatment itself, right? There are also practical considerations, like making sure the hospital is physically accessible to everyone.
Oh, absolutely. Things like having clear direction signs, navigation maps, even golf carts for patients who have difficulty walking.
Those kinds of things can make a big difference.
Absolutely. It's about making the hospital environment as user-friendly and welcoming as possible.
Now, another area that can sometimes be overlooked is effective communication, especially when there are language barriers.
That's a great point. Communication is at the heart of good healthcare, and hospitals need to be prepared to communicate effectively with patients from all sorts of backgrounds.
So what kind of things are in place to address language barriers?
Well, there's the use of sign language interpreters for patients who are hearing impaired and verbal assistance, or other methods for those who have visual impairments.
So it's about tailoring the communication approach to the individual patient's needs.
Exactly. It's about recognizing that one size doesn't fit all when it comes to communication.
The one thing that I found really interesting about the discharge planning process is that it doesn't just start when the patient is about to leave.
No, it actually begins much earlier, ideally right at the time of admission.
Why is that so important?
Well, it allows the healthcare team to start planning for the patient's needs after they leave the hospital.
So it's about anticipating potential challenges and putting support systems in place.
Exactly. It can help reduce the length of stay and prevent unnecessary readmissions.
I see. And who's typically involved in this discharge planning process?
It's a team effort. It usually involves social workers, physicians, nurses, and sometimes other specialists like physical therapists.
And what kind of information does the patient receive when they're actually discharged?
Well, they get clear instructions on how to manage their condition at home, who to contact if they have any problems, and when to follow up with their doctor.
Right, so they're not just sent out the door and left to figure things out on their own.
Exactly. There's a lot of emphasis on making sure patients feel supported and prepared for life after the hospital.
And they also receive a copy of their discharge summary, right?
Absolutely. It's a detailed document that summarizes their hospital stay, including their diagnosis, treatment, and any outstanding issues.
And a copy of that also goes to their primary care physician.
Exactly. So that there's continuity of care and everyone is in the loop.
Now let's talk about a sensitive but incredibly important topic: the procedures for handling cases of suspected or confirmed abuse and neglect.
That's a heavy one, but it's something that every hospital has to be prepared for.
So what does that process typically involve?
Well, the first step is to identify any potential indicators of abuse or neglect. This could be done through screening questions or observations by the healthcare team.
Okay,
And if abuse or neglect is suspected, the top priority is to ensure the patient's safety.
of course.
There's a dedicated team within the hospital that handles these cases, and they'll conduct a thorough assessment.
And if necessary, they'll also contact the appropriate external authorities, right?
Absolutely. That's essential for protecting the patient
Hmm.
and potentially preventing further harm.
Now, switching gears a bit, let's talk about clinical practice guidelines, or CPLGs as they're often called.
Yes, CPGs. They're essentially evidence-based recommendations for how to manage specific medical conditions.
So they help ensure that patients are receiving the most up-to-date and effective treatment possible.
Exactly. They're based on the latest scientific research, and they're regularly reviewed and updated.
So how are these CPGs actually used in practice?
Well, they're integrated into the patient's medical record, and they directly inform the plan of care.
So the physician can refer to the guidelines when making decisions about the patient's treatment.
Exactly. It helps ensure consistency and best practice.
Now, we've talked a lot about medical records and how important they are for so many things.
Right. They're really the backbone of a patient's medical history.
But obviously, there are also strict rules about who can access them.
Absolutely. Confidentiality is paramount.
Yeah.
Only healthcare professionals who are directly involved in a patient's care are allowed to access their records.
And there are also safeguards in place to prevent unauthorized access, right?
Oh, yes. There are policies and procedures to ensure that patient information is kept secure.
And what about the use of blood and blood products? I imagine there's some pretty strict protocols around that.
Absolutely. There's a whole set of policies that govern how blood is handled, stored, and administered.
And what happens if a patient has a reaction to a blood transfusion?
The transfusion is stopped immediately, and resuscitation measures are taken if necessary.
And then the incident is reported according to the hospital's protocols.
Exactly. It's all about responding quickly and appropriately to any adverse events.
Now, another area where hospitals are really focusing on safety is in preventing venous thromboembolism, or VTE.
VTE, that's a serious condition that can lead to blood clots in the legs or lungs.
So how do hospitals try to prevent this?
Well, every patient is assessed for the risk of developing VTE, and then appropriate preventative measures are taken.
So this could include medication or special compression devices.
Exactly. It's about reducing the risk as much as possible.
Now let's talk about the privileging process again. This is how hospitals ensure that medical staff are qualified to perform certain procedures, right?
Exactly. It's all about making sure that everyone is practicing within their area of expertise.
So how does this process work?
Well, a physician will request specific privileges, and then a committee will review their qualifications and experience.
And if they're deemed qualified, they'll be granted those privileges.
Right, and these privileges are reviewed regularly to make sure they're still appropriate.
Makes sense.
Mm.
Now, every hospital needs to be prepared for emergencies, right? So what kind of training is there for something like a Code Blue?
Code Blue training is essential for all hospital staff.
So they know what to do in a cardiac arrest or respiratory failure situation?
Exactly. They practice through drills, simulations, and they're also required to have up-to-date BLS certification.
And there are also protocols for dealing with deteriorating patients before they reach a Code Blue situation, right?
Absolutely. There's usually a rapid response team that can be called in to assess and stabilize a patient who's showing signs of decline.
And this team uses the SBAR framework to communicate with the patient's primary care team.
Exactly. It ensures a seamless transition of care.
Okay, now let's talk about the plan of care policy. I understand this is a very collaborative process.
Oh, absolutely. It involves everyone who's involved in the patient's care, including the patient themselves and their family.
So it's really a team effort to develop a plan that meets the individual patient's needs.
Exactly. And this plan is reviewed and updated regularly to reflect any changes in the patient's condition.
Now, sometimes a patient needs to be transferred to another facility, either because they need a higher level of care or because a different hospital has more specialized services.
Right. So there's a whole process in place to make sure these transfers are done safely and smoothly.
So what does this process involve?
Well, all the necessary paperwork has to be completed between the two hospitals.
And then there's the logistics of actually transporting the patient.
Right. The patient is usually transported by ambulance with qualified medical personnel on board.
And just like with internal transfers, there's a structured handover using SBAR to communicate all the important information to the receiving team.
Exactly. It's about ensuring continuity of care throughout the entire process.
Finally, let's touch on the international patient safety goals. These are like the gold standard for patient safety, right?
They are indeed. The Joint Commission International, or JCI, has developed these goals to help hospitals around the world prioritize patient safety.
And there are 6 main goals, right?
Yes. There's patient identification, effective communication, medication safety, safe surgery, infection control, and fall prevention.
So these goals really cover a lot of ground.
They do. And they provide a framework for hospitals to constantly evaluate and improve their safety practices.
Wow, this has been a really insightful deep dive into the world of hospital standards and procedures.
It's amazing how much goes into ensuring quality and safety in healthcare, isn't it?
It really is. It's clear that it takes a huge amount of planning, coordination, and ongoing evaluation.
And let's not forget the dedication of all the healthcare professionals who are working tirelessly to provide the best possible care to their patients.
Absolutely. So to our listeners out there, what are your biggest takeaways from this conversation? What aspects of hospital care are you most curious about? We encourage you to keep learning and exploring these important topics. And if you're interested in learning more about Terry and our work in medical health tech, visit our website at terry.care. You can also find more episodes of the Terry Podcast on your favorite podcast platform. So until next time, stay informed and stay engaged in the world of healthcare.
Thanks for listening, everyone.
Bye for now.